Staying with us. We now want to get into our big discussion tonight on the coronavirus outbreak. Some statistics for you right now. Recently, the World Health Organization declared it a global health emergency, with at least 1,770 people having lost their lives thanks to the coronavirus. In addition, in terms of infections, nearly 70,548 cases have been reported so far. Now we want to cross over immediately a distance of 8,800 kilometers from Nairobi to Wuhan, Hubei province, to speak to Jeffrey Okundi, he's a student there studying at the Chinese Academy of Sciences. Jeffrey, thank you so much for speaking to us this evening. I know it's about 2:30 a.m. where you are, so thank you for making time for us. First of all, you've been on lockdown for at least 5 weeks. How is that? How are you? Let's start there.
Hi, Mohiga. How are you doing?
Thank you. Fine, thank you. Go ahead.
Thank you very much for having us, for having me here right now. And for the past 5 weeks, life has been really, really hard. And let me just show you, this has been my life right now. A mask and ethanol just to disinfect once you walk out of the room. Wuhan is a very vibrant city, and for the 5 weeks that we've been under lockdown, the city has turned into a ghost town where there's nothing going on. And right now, the Chinese government is actually trying its level best to actually overcome the outbreak and contain it. So everything is on lockdown right now. There's nothing totally going on. So we've been
can you help Kenyans?
To our institutes at the moment.
I want to interrupt you. I want to interrupt you because I want you to help Kenyans understand, what do you mean by lockdown? Right now you're in your room. Can you go outside? Can you go to the building next door? Is that possible?
For the institute where I am, yes, I can move to the next building because the institute has been totally locked down. But there are others who are in like a university setting who are actually confined to their hostels. So you cannot leave the hostel. You can simply stay in your room and not walk out of the room. The farthest you can go is maybe to the lobby to get maybe the little necessities that are being provided. But lockdown means you cannot leave the school because even public transport has been stopped to try and stop the spread of the virus.
Okay. Which then makes me wonder, what are you doing for food? What are your immediate needs right now? How are you surviving?
Surviving has forced us to acclimatize ourselves to the situation that is at hand, meaning that an example of myself is that I try my level best to stay awake during the night so that during the morning when there's all this noise on social media and everyone is trying to call to find out how you're doing, so I sleep during the day and then maybe later on in the day wake up, work on my thesis, and then do a little workout, and then prepare to have the meal for the day because meals are actually very limited. So you find yourself having to just survive on one meal a day. And even that one meal a day, maybe sometimes you have to even just eat half of it and the other half keep it for the next day because you do not know how long we're actually going to be under lockdown and how long the supplies you have are actually going to be available.
Okay, so on this side, we've been getting lots of updates from the Kenyan government. Have you heard anything from them? When was the last time you got direct communication from the Kenyan government?
The last time I had direct communication from the government was maybe a week and a half ago when the ambassador called. The rest of the time we are getting news from either social media or getting news from the media houses who are actually notifying us what the government is doing. But the government is not reaching out to us who are in Wuhan. We're the ones, they're talking about us on media, but they're not reaching out to us to tell us what is going on. So like even today I saw a press briefing that was done and it's being stated that there's a committee that is working on our situation, but we do not know this. So who is being told all this information if the people in Wuhan are not being told what is going on?
That's a very interesting point you're telling us, because as we speak, we know that countries like Egypt, Morocco, Mauritius, etc., have evacuated their citizens in Wuhan. How does that make you feel as a Kenyan watching maybe fellow students leaving and you cannot?
In all honesty, Mwahiga, I feel like an adopted child of Kenya. Or a situation where a father has decided to leave his child to be taken care of by another dad, because the Chinese government is doing their level best to try and actually contain the situation.
Okay.
And our government should actually also step up and actually help them lift the load by trying to help their own citizens. If you're going to leave everything on the hands of the Chinese, you're putting too much pressure on them when they're supposed to be trying to consider their own people. So seeing other people leave, it's very disheartening. And we had a promise that we'll be evacuated, only to wake up the next day for a press briefing that we actually got to know about from the different people on social media, where it was stated, just stay in Wuhan. Stay in Wuhan, and people do not know what staying in Wuhan means.
I see. We have a representative of the task force actually here with us in studio. He can hear you. What's your message to him?
I would actually ask them to actually reach out to us in Wuhan. If it's a task force that has been put in place to actually ensure our safety, then why are you not reaching out to us who you're supposed to actually be getting the first-hand information from? Or who are they reaching out to? Because personally, I have not been contacted by anyone to ask me how I am doing, to ask me if I am physically okay, if I am mentally okay. And also, I would like to ask them we need to stop the issue of politics and talking and monitoring situations a lot. We actually need to, it's reached a point where nations are actually taking action. Why is ours not taking action?
Good.
And also we'd like to just ask them, there are so many of us here who are in different situations. There are those who are seeking medical help because they had conditions that they used to use medicine, they are not getting. There are families that are here that are not getting adequate food.
Totally understand, Jeffrey. And I want to interrupt you there because I want to give him a chance to actually respond. You've raised a crucial point. Every Kenyan there has a different challenge.